At the end of life, you might see or hear things that you're not used to. In this video, I'm going to show you real life footage of the death rattle and explain to you why it doesn't have to be so scary. The dreaded death rattle. Followers write into me all the time about how they did not know or expect to hear their loved one's breath at the end of life, and that this rattle or gurgling they heard scared them so much. So let me explain what it's really called and why it's happening. The death rattle is actually called terminal secretions, and it's very, very normal and to be expected. So here is why it's happening. As you can see, I just swallowed my own saliva unconsciously. This is happening to all of us, even you watching the video. Our bodies are amazing and they're creating saliva in our mouth so we can keep our mouth moist all day long. And then as we go along the day, our brain is telling our muscles to swallow that saliva. That is all happening automatic. Now, at the end of someone's life, their body is still making their mouth moist, because a mouth moist feels better than a dry mouth. Their body's making their mouth moist, but their brain is no longer telling the body to swallow that saliva. So that natural saliva that's being made in their mouth is just collecting in their mouth. Then on top of that, their mouths are really relaxed. And it takes muscles to keep your mouth shut. At the end of life, your whole body is relaxing, so those muscles relax as well. So their mouths are hanging open, that little bit of saliva is collecting in the back of their mouth, and with each breath going over that wet saliva, it makes a gurgling noise. So it is not, I repeat, it is not coming from their lungs. They are not drowning on their fluid. I hear that a lot. This is a little bit of saliva in the back of their mouth that's creating a lot of noise, and people really don't like it. So I think in this video, it's important that I have you listen to what some death rattles can sound like, because some sound different than others. So I'm going to show you a few different ones. And I want you to just know what it sounds like. If and when this ever happens to you and your loved ones, you know what to expect and you know what it is. After this, I will explain how we can help it. So I'm going to show you 3 different versions of what the death rattle can sound like. They all kind of sound alike, but I like to just show you 3 different ways they could sound. So trigger warning, here are the videos. So there you have it. Some death rattles or terminal secretions sound worse than others in the sense of some are louder, some are softer, some sound like snoring. It just depends on the person. And some people don't have it at all. But I will say most will at the end of life. And I think this is the surprising thing to most people. So I think it's great that we talk about it. It's great that you understand that they are not drowning on their fluids. They are not suffocating. It usually is just a little bit of saliva that is making a lot of noise. So how do we help it? Now, when I worked in the hospital for many years, all we did was suction our patients' mouths every 2 seconds. No saliva in their mouth to be found. So no one was having terminal secretions at the end of their life. Now, why don't we do that on hospice? We don't do that, one, because it's difficult to get a portable suction machine in the home. It can be done, but it's difficult. And we have found that people and families who continuously suction their loved one at the end of life, that suctioning tends to make their mouth make more secretions. So it actually makes it worse, when really the best thing we can do is kind of educate that this is a normal thing. It's not hurting your loved one. It could just sound bad. So that's why we usually don't do suctioning. 2, we have medications that can help dry up those secretions. So we can use a scopolamine patch on the back of someone's ear. That can help dry up those secretions. We can use a medication called Levocin. It's a pill that goes underneath someone's tongue. That medication can help dry up the mouth, to dry up those secretions. We also use something called atropine drops in the mouth that, again, dry up the mouth, dry up those secretions. So there are medications we can use to help decrease the terminal secretions. But I like to say this because it dries out their mouth. A dry mouth is uncomfortable. And I educate a lot about trying to keep our patients' mouths moist, their tongue moist, their gums moist, their lips moist. For continuously giving those medications, yes, that may decrease their terminal secretions or death rattle, but it will cause them to have a dry mouth. So again, risk versus benefit. I think personally it's great just to educate about how you can actually get rid of the terminal secretions. A lot of times just sitting your loved one up in bed, so if they're laying flat, their secretions might be a little louder. If you sit them up, sometimes that's all they need to do, and then the secretions move just a little bit and the noise will stop. Or you can just turn them on their side. If you turn them on their side, the secretions will come out, or you can use a sponge to kind of help them out. I think the main thing to know is that it's normal and it's okay and it's not hurting your loved one. The next question I always get is, how do you know? How do you know it's not hurting my loved one? It's a great question, and here's how we know. One, we are educated medical professionals who understand how to look for non-verbal cues that someone is uncomfortable. A dying person, if they can no longer verbally say, I'm uncomfortable, this is bothering me, they're like a baby. Babies cannot verbally tell us what is wrong with them, but we know if something's wrong with a baby, right? We can tell if they're fussy, if they're feverish, if they have gas, they cry differently, they're restless. That is the same with a person who is dying, who is nonverbal. They will show you if they are uncomfortable. They will be restless. They will be moaning. They will have a furrowed brow. They will be letting you know. So that's how we know. We physically look at the body. If the body looks relaxed, specifically if they're hanging open, relaxed, they may look different than the person that you know and love because their body is changing. But if they aren't restless, if they aren't moaning, if they don't have a furrowed brow, if you touch their shoulder and they still feel relaxed, they don't wince away from you, they are likely very comfortable. The end of life has things that go on that might seem scary, specifically because it's your loved one and you haven't seen it before. That's why education like this is so important, so you can prepare yourself to know truly what end of life actually looks like and to know how to care for your loved one during this time. So it's important that you can educate yourself through these videos to hopefully decrease that fear.